let's review some few case study. Like I said, new start of case study that you will see. It's a little bit confusing. You're going to have 4 patients, and then you have to basically take care of them simultaneously. And then they will pick one of them and they just give you an idea, but you have to manage all of them, be able to know what is going on with them. So this is the study. 4 patients, as you can see. The nurse is aware of 4 clients. 45-year-old with newly diagnosed cervical cancer. Client is receiving internal radiation using radioactive implant. Client is now in the bathroom. Are you worried about this patient? 55-year-old male with BPH, just had a TURP, transurethral resection of the prostate. 6 hours ago, is receiving bladder irrigation with clots in the Foley bag. Are you worried about this patient? 35-year-old male who sustained left femur fracture 3 hours ago. Client on skeletal traction. Client respiratory rate is now 25 with petechia on the soft palate. Are you concerned about this patient? A 65-year-old male with left-sided chest pain. Pain is relieved by leaning forward. EKG shows diffused ST elevation. 4 patients. You have to prioritize them. What do you want to do? Who do you think is sick? What do you need to do for each of them? I'm not asking you who is sick, but I just want to know if you can manage them. You don't know which patient you're going to pick. The 4 patient, one has a cervical cancer, radiation, and she's in a bathroom right now. Somebody has TURB, is receiving bladder irrigation and some clot in the Foley. A femur fracture 3 hours ago, skeletal retraction, respiratory rate of 25, and petechia in the soft palate. Left-sided chest pain, pain relieved by leaning forward. EKG shows ST elevation. Make diagnosis for each of them, and then you will know what to do with each of them. So, number 1, select one finding that is concerning. Look at them and see if there's any concerning feature for each of them. What do you see that is worrisome to you? You can't do that until you make a diagnosis and see what is wrong with the patient. 45-year-old, cervical cancer, is getting radiation, is an implant, and is still in the bathroom. You have TURB 6 hours ago, some clots in the Foley bag. Femur fracture 3 hours ago, on traction, respiratory 25, petechia is soft palate, on the soft palate. I try to make things straightforward. You can't make it no compliment, just basically commentary, straightforward. Just go for the things that you see is worrisome. Left-sided chest pain, leaning forward, right? Leaning forward. And the EKG shows what? Diffuse ST elevation. What findings do you think is worrisome? What finding? Select one finding that is concerning. Well, to me, cervical cancer is not concerning. What is concerning to me is the patient in the bathroom. That is my concerning feature. That patient should not get out of the bed. Otherwise, the implant comes out and it becomes a radiation problem. This is why the nurse should have the lead to pick it up and the lead container in case this happens, and she put it in. Remember, the nurse is going to wear the dosimeter so that if there's a radiation, they can tell how much is being exposed. But being in the bathroom is the most concerning thing, not the radiation itself, not the cervical cancer. Number 2, BPH, TURB 6 hours ago, irrigation, and some clot in the Foley. Clot in the Foley is concerning. But do you expect some clot 6 hours? Of course, yes. That is unexpected. Expect to see some clot up to 36 hours. So this is okay, but in this scenario, it's still concerning. 35-year-old femur fracture 3 hours ago on skeletal traction, respiratory rate of 25, and petechia. Which of this is concerning to you? This is very concerning. And petechia. So respiratory of 25 and petechia are worrisome. Those are features I should be worried about. Client number 4, 65-year-old, left-sided chest pain, relieved by leaning forward. And the diffuse ST elevation. The concerning features is a chest pain. Chest pain is always a problem. So which one is concerning? I've underlined. Bathroom, being in the bathroom is concerning, right? Clot in the Foley is concerning. Respiratory rate and petechia for patient 3 is concerning. And the last 4 is what? Left-sided chest pain. I said just select one. So just select one of them. But so far, I've not told you what the patient is suffering from. I've shown you the worrisome features that should give you an idea concerning features you should worry about. Okay, so that's the patient. And each of them, if they ask you concerning features, yeah, the concerning features will let you lead to diagnosis. Now, I said what? Name one possible condition each client may be experiencing. What do you think each patient is experiencing? Look at a case, pay attention to the buzzword, put it together, and you'll be able to figure out what is going on. Number 1, what is he suffering from? Cervical cancer, right? Getting radiation. It's in the bathroom. What is the problem? This is an exposure issue. It's a safety problem. Everybody is going to be in trouble. You're not supposed to get out, otherwise the thing is dislodged. So we have an issue with it. Number 2, just at the bed, TURB and bladder irrigation with some clots. There may be some bleeding. We're seeing clots. This is a suspected post-op problem. But what is the problem? It's bleeding issue. That's why there's clot there. The patient is bleeding. 35-year-old femur fracture 3 hours ago. In skeletal traction, respiratory rate of 25 and petechia. Those are buzzwords you should recognize. What do you think? Long bone fracture? All of a sudden, my respiratory rate is up. I look at my skin or my soft palate, and there is petechia. The hallmark of this diagnosis is petechia. If you see petechia, there's 3 ways it will happen. The fat from the bone go to your brain, go to your skin, and you go to your lung. These are the 3 places, and those are buzzwords. That is how the patient is going to behave. They have what? You go to the brain. If the fat embolize into your brain, what do you think the patient will show? What kind of symptoms they will show? You don't have to memorize, but just stick with the buzzword and the pathophysiology. If fat from the long bone go to your brain, it's going to block the vessel. If it block the vessel, you get confusion, right? If you go to your skin, it block the vessel and you get what? Petechia. If you go to your lung, it block oxygen going to your lung. You get airway issue. So whenever you see somebody, they give you somebody who has a fracture, all of a sudden there's a rash on the chest. on the soft palate. Most people don't. I did not put the chest there because I know you can recognize it. Your soft palate is part of the. If you go to the soft palate, your skin, your chest, yeah, that is petechia. Petechia hemorrhage, brain confusion, and the respiratory status changing. That is fat embolism. This is not pulmonary embolism. This is fat embolism. 65 years old, left-sided chest pain. The pain is relieved by leaning forward. And the EKG shows diffuse ST elevation. This is not myocardial infarction. This is what? Pericarditis. And the bars read is pain is relieved by leaning forward, and there is ST elevation, diffuse ST elevation. So pay attention. Whenever somebody has chest pain and they tell you the pain is relieved by leaning forward and the ST elevation is diffuse, that means all the leads as ST elevation, that is pericarditis. So we have a safety issue, we have a bleeding problem, we have the fat embolism, and then we have pericarditis. Those are the key. So you have to make the diagnosis. You make the diagnosis, you can figure out what to do with this patient. Now, you already make a diagnosis. Who should be seen first and second? I've given you keywords. I've emphasized some of the things you should pay attention to. I've given you the diagnosis. Don't worry about the time. Think about the diagnosis, what each patient is suffering from. And then if you are the nurse, what do you think? If you have 1 second, you want to give it to somebody who has a safety issue from the radiation exposure, somebody who may have some clots and is bleeding and it's suspected, it's 6 hours, you should see some clots. Or somebody who has what? Fat embolism with airway and skin problem and neurological problem. So petechia, confusion, and then respiratory status changes. The soft palate is part of the skin. You can see that. Or number 4, you think somebody who has pericarditis and the pain is relieved by leaning forward. What do you think? Who should be seen first and who should be seen second? You have to arrange them. Number one, and number 2. So you know the diagnosis. Think about it. You have to arrange them in with the priority. And that's what you do on the floor when you're working. Should I see number 3 or number 2 or number 1 or number 4 first? What should you do? Based on what I've told you, we have fat embolism. You have 1 second. You have to be sharp. Okay. Who has a breathing problem? That guy. We don't see electrolyte issue. Yes, we see electrolyte issue here. And they say it may be bleeding. You don't see shock. I never give you any blood pressure. So even though he has some bleeding, I never tell you he's in shock. In 6 hours, he's suspected. You have to be sharp. Hemorrhage, the same patient, right? Airway issue here. We have a neurological issue here. You don't have pain, but this pain is relieved by what? Leaning forward. Based on your analysis of B-sharp, is not arranging order. But think, this patient has no time. Respiratory rate is going up. He has petechia. He will be confused in the next few minutes. That means the fat has gone to the brain. Therefore, this must be seen first. Now, who should be seen second? Radiation, TURB, and TAP. Use the same analysis. Number 2 is an expected finding, so I'm not worried about it. Number 3 is also expected. When you have chest pain and when you lean forward, it goes away, your ST elevation goes up. That is consistent with pericarditis. The only time you worry about a patient who is pericarditis and that becomes a priority. Don't get confused with the chest pain. This is all pathophysiology. If they give you a pericarditis patient, you only worry about that patient if they develop constrictive pericarditis. And how would that present? They would develop tamponade. And what is tamponade? Check the Birch triad, right? Mafo-Hatan, JVD, hypotension. When you see that in a pericarditis patient, yes, that is your priority. Therefore, don't worry about it. This lady in the bathroom is not supposed to be in the bathroom. It's going to make things bad. So we got to see that one second. If there were no be number 3, that would be number 1. If there's no number 3 was not there, I would have picked number 1 because it's a safety exposure issue. The whole hospital is in trouble. We got to get rid of the lead and radiation. So this is number 2. So this followed by number 3 and number 4. So you should be able to do that. This will make your prioritization easy. When you learn how to like arrange them in priority form, it becomes easy and you can analyze each patient particular. So that's the way if they present it to you, that's the way. Now we're picking on number 2. Number 2 because that one is straightforward, right? He's 55-year-old. He had TURP 6 hours ago, receiving bladder irrigation with clot in the back. 18 hours post-surgery, client's report of lower abdominal pain, 8 out of 10. This is still prioritization. This is still test-taking strategy. This is still counting. This is still thinking, analyzing the question in the bad way. Patient just had surgery. He has transurethral resection of the prostate, and it's 18 hours and still reporting abdominal pain. If you don't know what TURP means, that means if this is the urethra, we have your prostate here. So this is the prostate. The prostate get bigger and push on the urethra, and then they don't have they have problem going to the bathroom. That's BPH. It's the prostate get bigger, and therefore it block the urethra. And then when you have to pee, they dribble. You have multiple bathroom trip. They cannot empty properly, right? So transurethral, we go into the urethra and resect the prostate, and therefore we're doing the surgery through the urethra. After the procedure, they put the Foley catheter. The Foley catheter will have 3 weights. There's one irrigating, and then one going to the bladder and empty. So 3-way catheter. Patient is 18 hours and is complaining of pain. It's all content, right? What would you do? What do you think may be causing the pain? I told you the major problem with this procedure is bleeding. If they bleed too much, they're going to clog the Foley. When they clog the Foley, the bladder gets distended and they have pain. Therefore, what do you want to do? 8 out of 10 pain. You want to give them pain medication? It's content. If you understand the procedure, you check how much urine is coming out to see if it's clogged. If it's clogged, there will be less urine. And you know they're getting retention. Bladder is getting distended and they're getting pain. Do you call the doctor? Who asks you, what have you done for me lately? Go see the patient, assess the patient, and figure out. He's having pain. You want him to breathe? No, it's not going to help him. It sounds good, but yeah, the problem is you have to make sure the catheter is not clogged. If it's clogged, they're going to have pain. So let's check amount of output in a 3-way catheter, and then we can know if this patient is in trouble. It's all based on understanding of the process. Your test is like that. Every question they give you is understanding of the disease process, transurethral resection of the prostate, what you expect post-op, and how do you teach the patient and manage them. If you understand that, you understand everything about transurethral resection of the prostate. So we will check and make sure the catheter is patent. Now, number 5. What is the next first action? I said these questions to let you think. Sometimes you say, hey, the answers looked similar. Why is he doing that? Yes, because that's what the boards will do. They say, oh, why? Then you end up changing your answer. But it's the same concept. Use the same concept. Answer the question the same way. Don't change. Say, oh, I'm picking another answer because of it. If we apply to the same concept, then use it. What is the next first action now? So look at the situation and answer it. Here's TURB 24 hours. Post-procedure, irrigation fluid was recorded 2 liters, and the output from the Foley bag is 1.5. This is the content I'm going to explain to you. If you never heard it before, understand it, and so that when they ask you your question, once again, if this is the patient laying here, okay, he's going to have 3-way catheter. So he's going to have the catheter go into the bladder. He has 3-way. One goes here and one goes here. Okay, so this is the irrigation. This is going to irrigate. It's connected to IV pole. It's irrigating the Foley. And this is collecting. Okay, and one who have a balloon. That's what it's called 3-way catheter. You put urine, you put fluid in, you go in to the bladder, then it comes out here. Remember, the patient too is going to have urine. He's going to pee, continue to pee the same way. That means the irrigation fluid plus how much the patient is making urine should be equal to what is in this bag, Foley bag. So this is the output. If you put 2 liters as irrigation, patient has to pee too. You will make probably like 500 ml. You should see in the bag 2.5 ml. If you get less than 2.5, you know there's something wrong. This is the key. This is the concept. The input plus how much the patient is voiding together should be equal to what you see in the Foley. If whatever is in the Foley is less than your input, you know that the patient is not peeing or something's blocking it. So if we irrigate with 2 liters, I expect if I put in 2 liters irrigation, I expect whatever is in the Foley should be greater than 2 liters. I see 1.5. I know something is blocking it. Something is blocking it. I'm not going to put more fluid in. Increasing the irrigation fluid is going to, nothing is working until you figure out what is the problem. If it's clogged, yeah, then you unclog it. Through the doctor will give you order to unclog it, flush it, unclog it. Then you can figure out. But I'm not going to increase the fluid rate because whatever I'm receiving is less than what I'm putting in. I'm not going to remove the Foley. That is bad. And this is a concept, rectal exams. The prostate, if this is the urethra and the prostate, the rectum is behind. Whenever they do transurethral resection of the prostate, don't ever do a rectal exams because when you do a rectal exams, you go into the prostate bed. When you put your finger in and you do exams, you just irritating the exam where they did the surgery. If there's a clot there, you're going to break it. So there's no rectal exams. There's no suppository. You just give them stool softener to go easily. But key, your board will confuse you with that. No rectal exams, no suppository. So even if they have constipation, give them something by mouth. Never put your hand in their rectum if they have TURB. So this is also wrong. Test-taking strategy, you got to choose number 4. Straightforward, right? I check kink. But this is the same concept as number 4, but in the different form. Try to let you know they can do that, but it's the same thing. Use the concept and I use it to answer every question, right? So that's that one. Now, I said, which of the following finding will need follow-up? Is the same thing. I'm trying to let you know the way they can answer the same question, because it's the same concept, because it's the same thing you need to know for this disease process. 48 hours just at the surgery after the TURP. He's complaining of spasm and he's asking you for oxybutynin, something to prevent the contraction. Pink colored urine in the Foley bag. You know they're going to have some bleeding. The urine is not going to be clear. It's going to be pink colored. The Foley output is 3 liters and the irrigation is 4 liters for 3 hours. I explained to you. And the blood pressure is that. Which one need a follow-up? Which one need a follow-up? Test taking strategy. I know the patient will be bleeding. But do you think this patient is bleeding with these vitals? Blood pressure of 110/70, heart rate of 70 is even better than me. Right now, teaching you my blood pressure is high, and therefore my heart rate should be high. That patient is stable, is not in shock. So this is fine. If you complain of spasm and you ask for oxybutynin, the way to memorize or understand medication for urology, if you see butynin at the end, they always do what? Stop contraction. Oxybutynins, they stop contraction. If you see like this, betanacol, nacol, if you see CHOL, any medication with CHOL is a cholinergic. Cholinergic causes contraction of your bladder. So if they give you a medication and it has last name call, betanacol, last name COL, think about it, it's going to contract. It's a little bit confusing. If he has this name at the end, butynin is an anticholinergic, so it will slow down the contraction. Patient is talking about spasm, we give him something to slow down the contraction, is good. You're supposed to see a pink urine in the Foley, is good. This patient is not in sepsis. Like I explained to you, if your output is less than whatever you're putting in, there's a blockage. Therefore, this is your priority. Number 3, need intervention. This is the one that needs intervention. Okay, guys. And the last one. They cannot give you a question related to TURB without this problem. What is the common electrolyte abnormality associated with this condition? 55-year-old with BPH at the TURB. Client is receiving continuous bladder irrigation. 72 hours post-procedure, patient report of what? Headache. I have one headache. I have become anxious. I'm confused. And my blood pressure is this. What is causing this problem? Is our concept. Which one of this is causing the problem? Think about it. They have a Foley catheter. They're getting irrigation. This is the bag. And they have your prostate here. We usually have a large volume. It's usually large volume irrigation. This can happen like 3-4 hours, 3-4 days, large volume. Most of the fluid is hyponatremic. Or the easy way to explain it is it's not isotonic fluid, so it has a lower sodium level. So when you use the irrigation fluid, we can't give you salt. So most of the is it has hyponatremic or hypotonic solution. That's the easy way. That's a better way so that you can understand. We usually use hypotonic solution to irrigate. So when you irrigate large volume, well, because of the surgery, they may end up absorbing the fluid. So they will absorb some of the fluid into their system. If you have large absorption of hypotonic solution into your body system, you get fluid overloaded. So don't be surprised. That's why he has headache and he's hypertension. This fluid will dilute your sodium and you have hyponatremia. That's why he's confused. He's anxious because he's fluid overloaded. In the end, what do you think is the major complication for this problem? I told you, you have patient is absorbing large amount of fluid, is diluting their sodium, they become hyponatremic. What is the major complication of this problem? What do you think it would, in the end, after the confusion, hypertension, anxiety, and headache, what symptoms are you going to be looking for? What symptoms are you going to be looking for? That's your B-sharp moment. What do you think? Based on what I've told you, hyponatremia, fluid overloaded, confusion, hypertension, the major complication of this problem is what? What do you think? I've already given you the answer. I said it's hyponatremia, normal 4. But why do we treat this problem quickly? It's because of seizures. They're going to go to arrhythmia, they're going to get confusion, respiratory distress, but the number one, they're going to seizures. So that's why we treat them. What is the name for this problem? What do you call it? It's due to large volume of what? Large volume absorption of hypotonic fluid. And this leads to what? Hyponatremia. And that's why you see all these signs and symptoms. It's called TURP syndrome. So that's the problem. You see, interesting case. I hope you gain something out of it. But this, every time they give you this kind of question, expect to go through that process. And you should be able to answer them if you just use the concept to do that. Any questions? So that's the 7 case study question. I put it together. But this is the way, you know, he has a bunch of content you're supposed to know. Happy Thanksgiving. This is for you guys, just to help out. I hope you enjoy yourself. Have a good day.